you. So I like handstanding because I want to see the world upside down once in a while. That would be very helpful. So first, I want to make a confession. I'm not a telehealth expert. I'm not a health IT expert, and definitely I'm not an investor. What I specialize in is the clinician-patient communication. So when I'm working, you would find me following doctors into the bedside or into the exam room bedside, and afterward, we're going to be just kind of chatting and talking about, okay, so what kind of conversation we had with the patient, and is there any opportunity to change it if necessary? So that's kind of what I do. Why would physicians be interested in the clinician-patient communication? Probably many of you already know that a certain type of communication styles will be beneficial in improving the health outcomes, patient engagement, and recently we've been focusing on patient experience and patient satisfaction. So what's in it for physicians? Of course, physicians got into their career because they want to help other people. So it used to be okay just to say, well, this is for the patient's sake. So somewhat you have to sacrifice yourself. So that really led to the problem of burnout and all those issues. So once we start doing this communication coaching, physicians realize, oh, actually it also affects my practice efficiency. Because if you learn how we can negotiate when there is a long list of concerns, how can we negotiate? Agenda setting, and we can commit, help patients commit to doing certain things. So practice efficiency is another reason. And it is super important to think about this physician experience and satisfaction. And I'm so glad to hear that you have been really talking about the importance of hearing the physician side voices throughout this conference. So I think this name really did it, Happy Doctors. So I'm a kind of strong believer that the word choice really matters when we do things. So I want to kind of propose that we use the word like care experience rather than just saying like patient experience or patient satisfaction or provider satisfaction, provider experience. So care experience kind of encompasses this both sides experience. So that emphasis on the provider side is super important because of the reason of the burnout among the providers. And the good news that I'm hearing probably from later from the UC Davis, as well as like Stanford and Mount Sinai, they started hiring chief wellness officers. So that's a really great news. So certain communication strategies that we work with our physicians. Okay, what do we do? So sometimes physicians have to say no. It could be a no to some medication or test that are not clinically indicated. So you have to say no, but you have to say no in a way that the patients would understand. Patients would feel, I am respected, I am actually heard. Sometimes we want to increase the care experience when the physicians feel, oh, this patient may not be really understanding what I'm explaining. So I want to really understand whether they are getting it or not. But we have to do so in a very respectful manner. We don't want to test them. Recently, there is this type of movement, I'm sure that many of you are familiar with, like the government-mandated survey of the patient experience, as well as the consumer-driven websites where they can really voice their opinions. That was a kind of wake-up call. Oh, actually, not quite yet. So physicians started feeling pressure from the consumers. Physicians thought that I am doing a great job. I am really listening to the patients. I am explaining it to the patients. But the patients don't seem to agree. So that is really a challenge. And that really brings up this frustration among physicians. Before I get into the detail of how the telehealth might be able to help, I wanted to kind of frame the question in a different manner. Several years ago, I was working with a medical group to introduce these video visits. And the question I often faced was, could telehealth do the things that we already do well in the conventional setting? And I was always put in the very, very defensive mode. And okay, showing the empathy, yes, I can do it if you do this and that. But I started thinking, when you're in a defensive mode, it's so hard to be creative and innovative. So in October 2018, I thought, okay, I'm gonna just question it this way. Could telehealth provide solutions for our challenges that we are already facing in this person visit in terms of the care experience? So this is what I hear from physicians. I listen, but some of my patients seem to disagree. Well, there are studies out there that says on average 18 seconds to 23 seconds once the patients start mentioning their concerns, they are interrupted. And the even bigger problem is that once you interrupt the patient is not gonna raise another concern. Then what's gonna be the result of it? 39% of the visits have this doorknob question. Oh, by the way, doc, how about this chest pain, right? So those are the issues that have been already done. When it comes to request, from patients' request, they say that 1/5 of the patients say, well, my requests have not been met by the visits. Well, that is somewhat okay, because some of the requests may not be legitimate, right? So you explain, but still patients would say, no, my request has not been met. But the problem, even bigger problem, is here. 9% of the visit resulted in no chance to mention the request. They said, oh, I didn't get a chance to mention it. That's definitely a problem. So in our coaching program, communication coaching, we will talk about, okay, what if we can repeat back to them their concern? How about rephrase it, summarize it, and let's make sure we're gonna say the all question, and what else? So that there's no doorknob question. How about actually counting with the finger so that it's so visible to the patients? Okay, 1 is this, 2, 3. So the theme often results in this making providers listening visible. And I thought, oh, telehealth, video visit, oh, it's visible. So what if, rather than just talking about main concerns, what if we really make the providers listening visible and we could be on the same page, literally? How about the request? We can do the same thing. So I thought, oh, telehealth could be very, very cool. Another issue that I often hear is, I want to engage my patients in their treatment, but they seem very passive. Well, we may not be giving the opportunity for them to be to be active. So what if we give them these options? This is from the motivational interviewing, some of you may be familiar with. It's called the agenda setting. Okay, which one would you like to talk about today? So they can kind of click and choose. Well, let me skip that one. Another one is, I know I need to show empathy, but, so there's a study out there. It says that physicians, in order for them to detach themselves for the clinical purpose, they actually downgrade their empathy responses. They are not really showing the empathy responses that the ordinary people would actually show. So they suppress it. What if we can actually see the patient somehow, the AI or whatever that may be, reading the words, tone of the voice, and maybe facial expression, and tell the physicians or remind them of the empathy moment. We can go even farther. There is a study out there that talks about this psychological counseling session. Well, actually, this Dr. Helen Reese is a psychiatrist. Basically, they say the emotional or the physiological concordance match up when there is an empathy experienced by the patient. So what if maybe providers could be hooked up to some measurement, then see whether it's really corresponding to or not, and say, oh, looks like you are in sync or you are not really in sync. That may help the physicians to take some action. That could become just a little bit of a trigger or a reminder of them of this emotional moment. Are you wrestling or dancing? You can kind of see that. So I have a dream that one day telehealth is going to provide wonderful care experience for both parties that we could not see in the regular visit. So that's my dream, and that may be already here thanks to all your work. So thank you so much.
I love that talk. It reminds me, while doing my PhD, the whole idea is how to figure out all the things in video you could do even beyond face-to-face. Thank you so much for all these great ideas and insights. We have time for a couple of questions. Okay. Erica, do you have a question? Oh, there's Peter.
Thank you for your talk. So it's probably not a secret that there are certain things you cannot do very well through a screen. And so how do you see those limitations giving us a sort of a realistic understanding of the limitations of telehealth care provision, and how might we be able to overcome some of those limitations?
So initially when I was given this topic, I thought, okay, yeah, I can talk about this digital bedside manner. Basically, okay, what you have to be careful about when you use the telehealth programs. So for example, this is a long time ago, but when we started doing the telephone visits, we were talking about, okay, you had to actually turn up the volume of your voice a little bit more. And you have to articulate what you're doing more clearly. Otherwise, they're not going to be seeing you, so even if you are sitting at a computer doing stuff, they can't see you. So you have to articulate. So those are the things that we talked about. So telephone visit, yeah, I'm sure that you have a list of tips, but how to set up your camera where so that the patients don't feel like they're looked down on. Those are all kinds of tips. I'm sure that you have already some tips. So yeah, but I think it's great to think about those, how to overcome, and also what can we do even better. So that's kind of my hope.
Great. Any other? Jeff?
Thank you for being here. So I have to say that this effort in trying to increase patient satisfaction or patient experience is to some extent potentially counterproductive in the sense that patients are demanding tests that aren't warranted, and they're asking for medications that may not be warranted. But that's just one aspect of this. The other aspect is that electronic medical records really interfere with this effort. And what I mean by that is that a typical doctor, at least a hospitalist, I'm not sure about outpatient doctors, will spend 8 hours in front of the computer and hardly 2 hours with a patient, if possible, well, a group of patients, I should say. So before EMR, I could spend 4 or 5 hours in any given day with my patients. Now it's about 2 hours at best. Very hard to provide quality in those circumstances.
Yeah, definitely that's what I hear from, I would say, 99% of physicians. It is definitely a challenge. So, yes, I mean, there are two levels of kind of questions. Okay, can we really change the EMR into the way that the physician can feel this is really a great tool for me and it is really easy to use? I feel good about using it. I think that's what I would like to see, but at the same time, when you go back to your practice tomorrow, that's a kind of gravity issue, right? Okay, that's already there. So in that situation, in that environment, what can we do better for the patients as well as for the physicians? So that's where I always come from. How can we really have the great care experience for both parties?
Erica?
Yeah, so I think recently I have started to seeing a lot of healthcare organization here start piloting remote scribe using a Google Glass. So the idea is, of course, to trying to take the physician away from the screen when they're doing documentation, so spend more time paying attention to the patient. But then there's an additional factor saying now behind that glass, I know there's a scribe sitting somewhere that I don't see in the room. Then all of a sudden I feel a little bit uncomfortable talking to the physician because there's someone else somewhere else. So can you comment on that?
Well, definitely the doctor-patient relationship, that's a very sacred relationship. It's a very sacred space. So it is, I mean, I would really recommend that the scribe will be in the same room and introduced so that the scribe is part of the team. That's how I did it at Mount Sinai. Google Glass, I'm not really a big fan of. I mean, I don't even have one, but just by looking at it, because in communication coaching, we look at how the physicians actually see patients, and sometimes these glasses, those are the ones that's kind of like, oh my gosh, you know, I know that you are really fashionable, but I don't know whether I can really relate to you because you know, you come through this really stylish stuff. So I don't know. I mean, I'm sure that there is a smarter, brighter mind in this audience for that one.
Yeah, thank you so much for that.
Thank you.
By the way, so one of our theme for our conference is getting access to expertise. You need, so this is the best physician coach and communication. Please definitely just get his email, contact with him. He's gonna make your practice just supercharge them.
Great.
Thank you so much.
Thank you so much.
Thank you so much.
Thank you.